And actually there is a marker on the machine which guides us properly.
Yes. The suction machine that we are using is between 110 to 130 millimeters of mercury. As you can see, there's the fluid that's gone into the lab, and they're checking the fluid under the microscope.
Yes.
And we are going to pick the eggs up out of this and put it in a different media and incubate it and then fertilize it. Can I have the camera back here, please? Please follow the camera once instructed. जब मैं बताऊंगी तब शिफ्ट करना. हाँ, पिकअप एक बार हो जाने दो, फिर लैब का दिखा देना. So we are going right to the other follicle. It's always best that you do not do multiple vaginal punctures and try to aspirate as many follicles through the single vaginal puncture to minimize infection. The screen is not clear. The camera needs to focus on the screen and make it clearer. You can change the angulation of the screen if necessary.
We can see that clearly. You keep it comfortable to your view.
Thanks, Parul.
Thank you.
Right. So once I finish taking out aspirating all the follicles, then we will check as to the number. It's always good to have a feedback from the lab to know if we are getting eggs.
So you have a bell or something from the
No.
different kind of bells people have from the lab?
No, we just get a feedback saying that yes, we are finding eggs. And some people want to know the count of each egg, and some would go egg by egg. I kind of feel reassured when I know that there are eggs, and then we just continue, and at the end I ask how many eggs. So,
okay. Ma'am, can you also tell us about the medias you are using?
Definitely. There are various media that we are using. We are using Cook, Vitrolife, Medical. So I think it's been very clearly proven that there is no particular media that gives better result over the other. So I'll just focus on this ovary for the time being.
And so we can see the lake beneath.
Yeah. If you can see what Dr. Parul is pointing is the iliac vessel that's running just below the ovary. And sometimes if you mistake it and it is in a different plane, like it looks like a follicle, and I might go beyond and rupture it. So you have to have your orientation, your angulation very, very clear to be absolutely safe.
And most important is the concentration. You feel like it is a very smooth going procedure, and suddenly the iliac can deceive you.
Absolutely. So can I have the egg count, please?
Any guesses from the audience?
So they're still counting the eggs. They've got about 5 eggs so far, and there's still tubes remaining to be checked. I will go on to the next side, and while I finish this side, I'm going to show you a double aspiration pickup in one of the follicles. It's done when there's a single follicle, and there is a lot of debate whether you should do single or double, and whether double really increases the chances of oocyte retrieval. But for the sake of completion, I thought I should demonstrate it to you. Before doing that, I'm going to aspirate a few more follicles.
You hear me, Kaberi?
Yes.
Yeah, Dr. Jindal from Meerut.
Hello, how are you? Welcome, welcome.
Yeah, I wanted to ask, how about reversing the image and getting the image upside down for a easier retrieval easier pickup? That's what I do.
No, I think it's very operator specific, and because I am used to this we keep it this way, but yeah, there are many operators who do it the other way around.
Yeah. Okay.
It's
And
all upon the how you started it, and then you become comfortable with the
absolutely,
procedure.
absolutely.
One more thing a doctor wants to know
Mhm.
is when you start your suction machine, you know, when you start at the moment you are about to enter the follicle, or once you are in deep inside the follicle.
When, okay, no,
Yeah.
once I'm deep inside.
Yeah, definitely.
Yeah.
Because otherwise you will be hitting the follicular wall, and which is very vascular, and unnecessarily you are going to get lot of debris and you know, follicular cells inside.
Right, I'd want a camera to follow the tube once again, please. So once the follicular fluid is taken,
It's not necessary actually.
please follow the tube.
Actually, it is not. You know, once you are comfortable with the procedure, you can carry on.
The tube is going to the lab. It's been handed over to the embryologist, and they're still checking the previous follicular fluid. Sometimes we take a break in between
Flexible.
to ensure completion before moving ahead. So back to the screen, please.
So, Dr. Kaberi, can you hear me?
Yes.
So there are many questions popping up.
Yeah.
One of them is when, at what time, what was the, it was an antagonist protocol,
Yes.
whether it was fixed or flexible.
Yes.
It was flexible, I
Flexible.
suppose.
Flexible. Yeah.
Yeah.
Flexible.
Most of the time we are comfortable with the flexible approach.
Yes. Yes.
And at what time you gave the trigger? While you are operating it at, you know, it's about
I gave it at midnight.
midnight.
So, yeah,
Midnight what? Post in the early 12 a.m. or 12:30 a.m. or so?
Yes. Yes.
Yeah.
So we need to. That's the reason we are scheduling it before the talk.
Exactly at the 34-hour, or it's more, or almost 36 hours now.
Yeah.
What
Ideal time is between 34 to 35
Yeah.
hours. You should do it just before you've given the trigger, to be on the safe side, especially with antagonist protocols.
Yeah, it's going to be 12. Yeah.
So
One thing more, there's a question that many people are comfortable with the line, you know, the guiding over
yes.
the monitor.
Yes, yes. Again, yes, it's a user operative. We trained that way, but with time, I find
time,
it's a blur in
you
my
are more
vision.
comfortable with your approach. You have an imaginary line
Yes.
after some time, and then you go through that line only.
For beginners, it's very, very
Yeah.
important to have the guide. It's also very important to push your probe to the vaginal wall as much as possible, so that there is no intervening gut or anything that's coming in between your probe and the ovary. And also, while I was training, I was at Guy's Hospital, and the initial 2-3 months, I was just allowed to do TVS and not do a single pickup. I was getting frustrated by the end of 3 months when I asked my coordinator. I said, you know, when am I actually going to do the process? And they said, first you become good at TVS, and then egg pickup is like a cakewalk.
Yes,
And
very well.
actually, that's the fact.
That's a fact. Everybody, whoever is thinking of going ahead with the pickup, should actually have at least 2-3 years or a good hold on the TVS.
Absolutely.
As you can see, that the same, you know, the internal iliac is again and again looking like exactly like a follicle.
Yeah. So I've got a few follicles remaining, and I'm going to use this to demonstrate the dual needle. So if you can open the dual needle, and
So you are now changing over to a dual needle.
yeah, that's for just for the sake of demonstration, Parul.
Oh, sure, sure, good.
So if I can have the camera here, please. So this is the dual needle, and there are 2 lines going from here. One goes to the tube where the fluid will be collected, and that will be attached to the suction